my record button. Okay, I figured this would be a pretty interesting topic since, this is something we all do every day. Ideally, we're doing it about 8 hours a day. So if you're spending that chunk of time in a certain position, it can cause some different issues. Okay. So let's just go through this presentation. There's not going to be much demonstration. It's more of a presentation today, but let's go ahead and go through it. All right, is everyone seeing my presentation? Can I get a yes?
Yes.
Perfect, thank you. All right, let's start with back sleepers. Okay, so those of us who like to sleep on the back, the pros here, we can see that it aligns the spine. Okay, if we have back pain, it's a good idea to sleep on your back, but you want to elevate the knees. Okay, you want to put a little wedge underneath your knees, and I'll show you a picture of that here in a second. Cons, it's not necessarily good for those with sleep apnea. It kind of gravity pushes down on the airway and it makes it a little bit harder for those airways to open. Same with, for acid reflux or GERD. Lying down on your back can cause, gravity to kind of push back up some of the things we've eaten, some of the acid in our stomachs to kind of go back up. A way to resolve that is we can get a wedge for our upper body. Again, there's a picture for that as well. And then on our back's not really good for pregnant women as well. The gravity can pull down on the baby, which can kind of push down on a big vein that we have deep in our stomach. It can kind of restrict blood flow back to the heart. So we recommend side sleeping for that. But some things that I recommend for those with the back pain, you can see the wedge over here underneath the knees. Okay, it doesn't have to be this fancy of a wedge. Okay, it can just be a couple extra pillows just to get those knees bent a little bit, the hips a little flexed. Okay, that's going to help that back pain. Those with sleep apnea, GERD, acid reflux, this little wedge pillow here is really nice to help your upper body be in a little bit more upright position. Okay. You can also, get a little bit bigger one here where you can actually have a pillow underneath it as well, so that you kind of have all of the comfort going on. But that's kind of a two-in-one picture. Okay. This gentleman right here on the right, I would almost prefer to see his pillow switched the other way. His head's a little bit off. I'd like to see that a little bit closer to the bed. But essentially what I want to show you in this picture is notice how the pillow is not under his shoulders. Okay. I've seen a lot of people when they have the pillow underneath their head when they're lying on their back, that it goes underneath their shoulders. So it doesn't really matter what pillow you have. What you want to try to do is tuck it underneath this space as much as you can. Okay. So that this part of the neck right here, hope everybody can see my cursor, so that this part of the neck right here has a little bit of a round to it. Okay, so you want to tuck your pillow in and fill in all of this available space, and then let your head gently come into that extra little padding underneath the neck. Okay, so those are the recommendations for back sleepers. I try so hard. Side sleepers, this is probably one of the most common ways people sleep. Okay, it's really good for those with sleep apnea. Okay, it keeps the airway nice and open. Checking the chat box. Sleeping on the right side is really good for those with any sort of heart issues. Okay, because it puts the heart doesn't have to work as hard. Because our heart's a little bit closer to the left side, right? And so sleeping on the right side, if you have any sort of heart conditions, high blood pressure, congestive heart failure, anything like that, it's a good idea for you to try to sleep on your right. If you're a pregnant woman, left side is going to be a little bit better. They show that it helps increase blood flow to the fetus by sleeping on your left side. So ladies, it's a great idea for you if you're pregnant to sleep on the left side. And cons to side sleeping, shoulder pain. Okay, so if you have any sort of shoulder pain, obviously that's not going to feel great. If you have a shoulder issue, you want to sleep with that shoulder up and a pillow tucked underneath that arm. Okay, I'll show you a picture of that here in a second. This was something that I actually learned coming up with this presentation that I didn't know before. I thought was kind of cool. When you sleep on your left side, it can activate your sympathetic nervous system. Okay, so that's that fight or flight. You know, you hear the stories of, you know, a car runs over a kid and a mom's able to like lift the car up off the kid, right? Because the adrenaline's going so fast, and you're just going outside your mind to move that car. That's your fight or flight system. Okay, so when you're lying on your left side, and you're lying on that heart a little bit, that can kind of trigger to that sympathetic nervous system, which can kind of decrease your quality of sleep. Okay, so again, sleeping on the right side is going to be a little bit better. When you sleep on your side, it puts pressure on your joints. Okay, specifically the hips, and especially if you have a spring-loaded mattress. Okay, so you're putting pretty strong pressure points on that hip joint onto those springs. Okay, and then also sleeping on your side, if you have the bottom arm up your head, you have any sort of tennis elbow, that medial epicondylitis they call it. It's on the middle side of the elbow. That can actually stretch those muscles out and put a lot of stress on them, and you can wake up with some of the nerve stuff we talked about a few weeks ago. So you want to teach yourself to sleep with that arm in a downward position to save that elbow. So I like this picture here on the left. First thing, let's start up at the head. Look at how thick her pillow is. Okay. When you're lying on your side, how much space there is between your shoulder and your head. All of that space. Okay. All that space, our head's going to get in a wonky position, and we're going to wake up with some neck pain. Okay. So when you're sleeping on your side, nice thick pillow. Okay. Then the other thing that I highly recommend is knees. Okay, so you can see the angle of her top leg here, right? This is a little bit flatter than this. When this leg on the top is going to drop down past somebody's mic is on. Do you mind everyone muting your mic?
Said that it was drying up, correct?
Bringing when those knees collapse in together like that, that puts a lot of pressure on this hip. We talked about a couple of weeks ago. There's some things out here on the outside of the hip that are being stretched and strained, and just putting that hip in a not great position. Okay, so we like to see that knee up. Something that I got a couple years ago that I will advocate till the day I die is this little wedge. Okay, it conforms nicely to your inner thighs here, and it just kind of sits there. For the most part, it stays there. Every once in a while, I have to kind of readjust and get it back where I want it, but for the most part, it keeps my knees apart, and it saves my back. It feels tremendous in the morning. I had the same question, Rod, when I was looking at this picture. I was like, where'd that arm go? Looks a little weird. But yes, her arm is in there somewhere, we think. So side sleepers. So this is ideal. Okay, but yes, there are a lot of things going on here, and I can't expect you to do this every night. It is one of those things that if you're in these types of positions, it'll help you fall asleep. Okay, so that at least you're not staying up late or struggling to fall asleep because you're in a super comfortable position. But I put this picture in here because there's a lot of things I want to show you. First of all, you can see how she has extra thickness here with these towels underneath. Okay, to absorb these curves here, right? And look how thick that is when you're sleeping sideways. If you have one tiny thin little pillow down here, your head's just going to be all sorts of crooked. Okay. This one just kind of keeps the spine a little bit straighter. This one's a little bit overkill down here, and there's just a couple towels. This one I do like, that extra pillow up here. Just like I talked about with the hip, when the hip's kind of dropping down. Shoulders do that. When our shoulders go in front of our body or down on our side while we're sleeping on our side, we can get some issues up here in the shoulder too of different things being stretched out that we don't necessarily want stretched out. Okay, so I like this pillow here just to kind of put this arm in a very neutral, comfortable position. And then again, here is the wedge between the knees to keep the knee from falling down past that midline. Okay, so yes, Russell, there are a lot of pillows here. Okay, I'm recommending 2 and then the wedge. So yeah, this is actually my preferred sleeping position. I have a nice thick pillow that I got a couple years ago that I should probably update and renew, but I love my pillow. I keep a cheap little pillow here under my arms, and then I have my wedge here between my upper thighs to keep my knees apart. And that's how I fall asleep. Stomach sleepers. This minimizes snoring and sleep apnea, so that's about the only pro to sleeping on your stomach. It gets your spine just all out of whack, especially depending on what kind of mattress you're sleeping on. Gravity just takes over and pulls your spine in every which way. Okay, there's no way to sleep on your stomach in a perfect spinal alignment because your head has to be twisted one direction, which is going to pull on one side of muscles and it's going to tighten up the other side of the muscles. So that's why we're going to wake up and we're going to feel like our neck is, been yanked on all night. And then it can cause hip pain too, as well. Typically, when you sleep on your stomach, you rotate ever so slightly in one direction to get your legs kind of comfortable, and that's going to lead to a little bit of hip pain just because it's not in that good alignment. Recommendations for stomach sleepers: become a back or side sleeper. Okay, that's about all I can say there. I know it's hard, to retrain yourself to fall asleep if you've been, conditioned to sleep in one specific way. However, it's just about trying to fall asleep, trying to slowly acclimate yourself to a change. If you've been a stomach sleeper your whole life, I don't expect you to all of a sudden lie on your back and then fall asleep. Okay, so try to get into a more ideal position. And of course, you're going to wake up in the middle of the night and find yourself in a different position, and that's okay. It's all about just trying to readjust and get back to where you should be. Again, so we're not spending 8 hours in one not so great position. Okay. Decided I would talk about a little bit about mattresses and pillows as well. Those of us who are side sleepers, you're going to want a soft to medium mattress. Okay, so the memory foam, polyfoam. You don't want those springs, like I said, when you're lying on your side. Those hips and shoulders and ankles and all are pushing down on some springs, and it's just not the best for those joints. Okay, back sleepers, you're going to want something medium to firm. Otherwise, you're just going to kind of sink in, and it's not going to really give you the benefit of sleeping on your back that we want. Okay, if you are a stomach sleeper, the one thing that you can do is get a firm mattress so that, again, gravity is not winning and pulling you down into the comfiness of the bed and getting your spine even more out of whack. Okay. And then my recommendation is don't skimp on a mattress. Ideally, you're spending 1/3 of your life there. Okay, so let it be something that's comfortable, that's going to help you to wake up and be ready to start your day, not tight, not sore. So if you're going to splurge a little bit somewhere, I would highly recommend on a mattress just because it's, 8 hours a day. Pillows, kind of like I talked about a little bit, side sleepers, you want something super thick, like 4 to 6 inches. You want it to hug your head and still give enough room for your shoulder to fit. And then you want to hug a second pillow, one, to allow the arm to rest, and two, especially those of us who have been, something I read that if you're a stomach sleeper and you're trying to transition out, holding a pillow up against your chest while you try to sleep on your side can kind of, tell your body that maybe you are sleeping on your stomach. It kind of gives you that tactile information of something on your chest. Reports have shown that it kind of helps people learn how to become a side sleeper. Back sleeper, 3 to 4 inch thick pillow. Again, you want it to cradle down to your shoulders, but not under your shoulders. And so anything that's kind of malleable, so like a down or shredded memory foam, that you can squeeze up to your shoulders, again, not under your shoulders, and cradle your head so you're in that neutral position. Stomach sleepers, you're looking for something less than 3 inches thick. Okay, super thin, possibly not even a pillow. And you're almost better off having a pillow underneath your abdomen. That's going to prevent that, middle of your body sinking down into the mattress, putting a lot of undue pressure
Jenny Humphrey or Jeannie Humphrey.
And it puts those hips in a more flexed position, which is going to save your back. Okay. Again, these are all general recommendations. I don't know everybody's individual situation, if whether you can or can't sleep in any of these positions. Some of you have no choice, and I understand that. Again, these are general recommendations and like ideal scenarios, but I believe that's all I have. Any questions on sleeping positions? I know it's kind of you know, just a presentation today. It wasn't any sort of demonstration, but I figured that was a pretty cool topic since we all do that every day. Any questions? Let's see. The cons of being a stomach sleeper over time. When we talk about posture and we get that, you know, excessive lumbar lordosis, so we get that super extra curve in the low back, the more you sleep on your stomach, the more it's going to shorten those tissues and just make that low back pain even worse. So that's one of the bigger ones. It's compressing joints in your spine, and we don't want that. We want the spine to move in the other direction, more ideally. And then what else? What are the cons? Honestly, the head and neck, because you, like I said before, you can't sleep on your stomach without your head being twisted, you know, 80 to 90 degrees in one direction. Okay, so we're just going to tighten up and stiffen up in our upper neck. That can cause headaches, stiff necks, all sorts of things. So yeah, so try to move on to your back, try to move to a side sleeper position. It's just going to be more ideal in the long run. Any other questions? If not, I am going to step off. You have an, if you have, oh, is that anterior pelvic tilt? Anai? I was thinking appointment, apartment. Yes, the anterior pelvic tilt, that's that excessive lumbar lordosis. That those tissues tighten up, cause a lot of low back pain. And that's okay. That wedge underneath your knees is really going to help. Anytime your knees bend, your pelvis goes into a posterior pelvic tilt, which is a more ideal position. Tammy, I think with your situation, that's perfectly fine. You know, sleeping on your back in a reclined position. If you're comfortable and you can get some sleep, that's great. 100%. All right, guys, that's all I have for today. Okay, I'll hang out for a couple more minutes if you have any questions. Otherwise, you guys are free to go. Thanks for watching.
Thank you.
Mm-hmm.
Thank you.